Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I'll be talking to you about how do we do diode laser hair removal. So laser hair removal is there for last many years, and the actual word what is called laser hair removal is not the right thing, and the right word is laser hair reduction, because the laser cause selective photothermolysis of the hair roots. So what we have to understand is that there are various lasers that are available, like IPL, diode, alexandrite, long pulse Nd:YAG, and they are different in their wavelengths, and they are suited for different type of skin. For darker skins, Nd:YAG works very good because it has got more than 1000 nanometer wavelength. Diode has a wavelength between 800 to 810, and it is suited with people of wheatish color. It is very good for people from the northern India. When we come to alexandrite and IPL, it is usually more effective for the finer hair because the wavelength is less, something like 755 or 700. So in IPL and alexandrite, it works for the finer hair. So today I'll be showing you how we are doing a diode laser hair removal. This is the sixth session with a male client. And when we give a diode laser, there are few things that are very important. Number one, the jewels that we select. If we to give them less jewels, then there can be paradoxical hair growth. If we give them more jewels, then there can be burns. The second important parameter is the pulse width. That is another very important thing. So normally we keep pulse width nearly about 40 milliseconds or close by that. If we increase our pulse width, then the damage to the hair is more, and if we decrease the pulse width, then the laser doesn't get much time to contact with the hair roots. Especially if we are going with the higher joules, then we have to decrease the pulse width, and if we're decreasing the joules, then we have to increase the pulse width. So that is something we have to keep in mind. The other is the type of laser that we're using. The most popular for a full body laser removal is the laser in motion, where we are constantly moving our laser probe and machine. We are not stopping at one place for a long time. That is called the stacking mode. So in motion mode is much better than the stacking mode. It is less painful and it gives better results, especially if we give about 3 or 4 passes, the results are better. Now another thing that is to be remembered is that the hair follicles are in different phases, like anagen, catagen, telogen phase. Only the hair follicles which are in anagen phase can be affected by lasers. Those who are not in anagen phase are not affected. So multiple sessions of laser, about 10 or 12 sessions, may be needed to give you full results. And the laser doesn't work on hair which are not black. So for gray hair or white hair, the results are not there. And also for the hair which are very fine, laser hair removal or hair reduction may not work. So let's look how do we do laser hair reduction in a patient using diode laser. So let's have a look. So we are showing how we are doing laser hair reduction in this patient. So you see that we are using a diode laser, and diode laser is typically 800 to 810 nanometer. It causes the selective photothermolysis, that is, it damages the hair follicles specifically, and we have made grids, and we are doing very rapid passes in these grids so that the diode wave light can damage the hair follicles in these grids. We are also doing a good cooling. We have kept ice packs, and also the machine has internal contact cooling inside it. These are the settings that we have done. We have got maximum cooling. The pulse duration is 40 millisecond, and the frequencies that we are using are 8 Hertz, and we are using 100 joules. These are the settings that we are doing in this. And this is called diode machine in motion because we are constantly moving and shooting the diode. We are using a very high frequency and a high joules. This is the 7th sitting for this patient. Laser hair removal requires multiple sittings. Normally we may require up to 8 to 12 sittings. In males maybe more sittings may be needed, and these sittings are about 3 to 4 weeks apart. It causes hair reduction rather than hair removal, but the common word that we use is laser hair removal, but actually it is not removal, it is reduction. Actually, hair follicles are in 3 stages: anagen phase, telogen phase, catagen phase. Only if the hair are in the anagen and active phase are the lasers able to work on them. The hair follicles in telogen and catagen phase are not affected by the lasers. Similarly, lasers do not work on the hair which are very fine, which are grey or white in color. Their lasers do not work, and then we have to use electrolysis or thermolysis for those conditions. So this is how we are doing laser hair reduction, and we are moving in motion in various grids that we have formed, and we are giving at least 2 or 3 passes on each grid. When we do laser hair removal, it is very important to keep joules, the pulse width, and other parameters very well controlled. These are some of the results of laser hair removal in our setup. You can see, and we can use either diode, IPL or triple wavelength, or in combination we can use depending on the type of hair. So these are some of the before after results.